Hi, I'm Tara Schmidlin, one of the CPMC genetic counselors. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Ulcerative colitis is a type of inflammatory bowel disease. The most common types of inflammatory bowel disease are ulcerative colitis and Crohn's disease. Ulcerative colitis is a chronic condition caused by an autoimmune response in which the body's immune system, which normally fights infections and viruses, is misdirected and attacks the body's own normal, healthy tissue. In patients with ulcerative colitis, the immune system attacks the tissue along the intestinal tract. The inflammation most commonly occurs in continuous stretches along the innermost lining of the large intestine, or colon, and the rectum. Although ulcerative colitis can occur at any age, most individuals are diagnosed between the ages of 15 and 30. Intestinal inflammation can lead to symptoms of ulcerative colitis, including rectal pain, rectal bleeding, tenesmus, which is an urge to empty the bowels with an inability to do so, bloody diarrhea, abdominal pain, abdominal cramping, weight loss, and fatigue. It is important that you tell your doctor if you are experiencing any of these symptoms. Without treatment, ulcerative colitis can lead to dehydration and shock, kidney stones, osteoporosis, liver disease, inflammation of the skin, joints, and eyes, rapidly swelling colon or toxic megacolon, and perforated colon. Individuals with ulcerative colitis are also at an increased risk for colorectal cancer. There are many factors that make up your overall risk for developing ulcerative colitis, some of which you can control and some you cannot control. The primary risk factors for ulcerative colitis include being Caucasian, having Ashkenazi Jewish ancestry, being under the age of 30, and having a family history of ulcerative colitis. Genetic risk factors can also contribute to your risk of developing ulcerative colitis, as well as non-genetic risk factors, such as the use of acne medications like Accutane. We mentioned genetic risk factors as contributing to the risk of ulcerative colitis. It is estimated that about 23% of the risk of ulcerative colitis in the Caucasian population is due to differences in genetic risk factors, while the remaining 77% of the risk is due to differences in non-genetic risk factors. It is not possible for ulcerative colitis to be diagnosed by genetic testing. Ulcerative colitis must be diagnosed by a gastroenterologist using blood tests, stool tests, colonoscopy, sigmoidoscopy, and imaging tests like X-rays or CAT scans. Now let's talk specifically about the CPMC results and genetic risks for ulcerative colitis. Studies have shown that a particular genetic variant called RS11209026 is associated with a reduced risk for ulcerative colitis in people who have 2 copies of this variant. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this protective genetic variant you have. Individuals who do not have this protective variant will have a non-protective variant instead. Having a non-protective variant does not increase your risk for ulcerative colitis, but it does not offer the same protection against the disease as seen in individuals who have the protective variant. Your ulcerative colitis results tell you about the impact of a protective variant on your risk to develop ulcerative colitis. Having 1 or 2 copies of a protective genetic variant decreases your risk of ulcerative colitis compared to individuals who have 2 copies of the non-protective genetic variant. Having 1 or 2 copies of a non-protective genetic variant increases your risk of ulcerative colitis compared to individuals who have 2 copies of the protective genetic variant. Remember, ulcerative colitis is a complex disease, which means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes ulcerative colitis, so no single genetic variant will completely predict your risk for ulcerative colitis. Results of CPMC testing alone do not diagnose ulcerative colitis or rule out the chance of developing ulcerative colitis in the future. Genetic variant information can help estimate your risk of ulcerative colitis. However, other risk factors like your family history may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of ulcerative colitis in the future. As we learn more, your estimated genetic risk for ulcerative colitis may change. We'll keep you updated on changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.